Some of us ride bikes, some of us drive cars, and some even ride motorcycles. Regardless of which one you use, these items require routine maintenance. This is to ensure they're safe for use and they are efficient in what they're supposed to do. Likewise do our bodies. We go through a lot on daily routine, and so this translates to our bodies that require routine maintenance. And this is why today I've decided to talk about this video, because September is one of those months that has several healthcare awarenesses that need to be aired out there for each and every individual to be well informed about what we need as individuals to help keep ourselves healthy. So just so you know, this video is informative only and is not meant to replace any care you receive from your healthcare professional. So what do I mean by preventative care? This is the lifestyle choices and visits within our healthcare professionals that help promote our health and well-being. Some of these things that we need to do on routine basis include yearly physical exam, which is also called annual wellness visit, regular dental check, regular eye exam. So for dental check, they recommend every 6 months to go for cleaning, and based on the health status of your teeth, your dental hygienist or your dentist might recommend you be evaluated every 3 to 4 months just to ensure healthy gum life. And this is another story for another day. Trust me, you need to take good care of your dental hygiene. I don't know where you are, but here in the US, even with insurance, dental hygiene is very, very expensive. So trust me, dental hygiene is very important. Eye exam, immunizations, screening for certain health conditions, health lifestyle choices. This can be received from your regular dietitian or just your regular primary care provider or any other healthcare professional that you see. Eating a healthy diet, getting regular exercise. Those are some kinds of healthy lifestyle changes that you might get from your healthcare professional. Other lifestyle changes include not using alcohol or limiting the amount of alcohol you use, avoid smoking, and many other lifestyle changes. So as always, there's always expectations from us as individuals and even expectations from your healthcare professional. So some of the healthcare professional expectations when you visit your healthcare provider include checking for routine things like your height, your weight, and with your height and weight, they'll calculate what is called body mass index, and this tells the relationship between your height and your weight and helps categorize whether you have a healthy body mass index or you have an underweight or you have an overweight. So once you reach overweight, it moves on to obese and then morbid obese. And there's controversy out there about weight and height not being fair for shorter people, short-statured people, because the BMI, or rather the body mass index, is calculated based on the weight and height. So this is a discussion, and every individual, every healthcare provider will tell you differently. In the past, it's always been categorized as healthy body weight ratio, underweight, overweight, obese, morbid obese. Other things that your doctor will check include your body temperature, your blood pressure, your heart rate, your oxygen level. Those usually are gathered by the medical assistant or the nurse who's in the front part before you see your provider. So by the time you see them, they already have all the information they need from you. And during the visit, you'll also receive some counseling from your healthcare professional. They'll talk to you about routine health maintenance, lifestyle changes. If you have any chronic illnesses, they'll talk to you about those as well. And as we continue moving on, this channel is geared towards lifestyle change, motivations, and vlog. So I'm pleading with you, if you're able, please consider subscribing so you can be part of this channel. This month, I will definitely gear more towards education and I hope we can all learn a lot together. So please consider subscribing, turn on your notification bell so you are notified every time I upload a video. As we move on, the other things your provider will love to know when you visit them is your past medical history. And if you've been seeing the same professional before, they should have your records. So they'll just go over them to make sure there's no changes since your last visit. The other thing they'll need to know is your family medical history. What is your lifestyle? Do you drink? Do you smoke? If you do, how much of each do you use? Are you physically active? Are you sexually active? What's your emotional status? How is your diet, your exercise, your relationship? How is your well-being overall? How about work? And work is another place where we as individuals can go through a lot of changes without realizing that it's affecting us. So that's another thing they'll ask you. How is your life at work? Are you managing it? Is it stressful? Do you find yourself overwhelmed by work? The other thing, especially here in the US, is to do with firearms. There are people who have firearms in their houses. So that's something your professional will ask you. Do you have firearms? Do you feel safe with your firearms? Have you thought of using it to harm yourself? Is it locked up in a secure place? And if so, who else has access to it? So these are some of the questions that your healthcare professional might be able to ask you. The other thing your healthcare professional will talk to you about is vaccinations. And these vary according to schedules, and some of them are routine yearly, like the influenza. Some of them are based on age, and some of them are based just on season, or if there is like if you're pregnant, there are some immunizations that they'll recommend. So these are some of the things they'll talk to you about. The other thing they'll do is blood work. We need to know what our blood work levels are, and this can tell us the function, our kidney function. Are they in a good place? Is there a concern of going into kidney failure? They also help find out if you might be developing diabetes or if you're diabetic. They also help screen for cholesterol abnormalities. And based on your lab work, your provider will talk to you on what you need to do, what you need to change. Are they going to start you on any medications? And I also mentioned diabetes screening. So that's something very, very important. And I'll do a video separate on diabetes as a whole. And diabetes is very broad. And it's one of those diseases that can creep on you slowly without knowing. That by the time they find out you have diabetes, it's far gone, and there could be several damages that might have happened. So it's good to keep up with your routine screening, or even just have a glucometer at home that you can use just to find out what your sugar levels are. They also do some exam, and these exams can pretty much head to toe. They do those evaluations on you, those exams, to make sure everything is going on okay. They listen to your lungs, they check your ears, they check your throat. If you're a female, they'll do the breast exam on you. Mostly it will be the gynecologist that will do that, but some primary care providers will do that as well. They'll educate you on healthy eating habits, on lifestyle changes. They'll talk to you about routine health maintenance like dental, how to keep a good eye health. They'll talk to you about safety. And when we talk about safety, it's a very broad area. And I mentioned briefly about firearms. The other thing they talk to you about safety is using seat belts while you're driving, making sure if you have children, they're buckled in the back seat and in the correct seats that they require. The other thing they'll talk to you about safety is drinking. Avoid drinking while intoxicated. Unfortunately, many people still lose their lives on the road just because of irresponsibilities of other people. You find somebody's drunk, but they still choose to drive while intoxicated. And this person, number one, they don't care about themselves. And number two, they don't care about other people on the road. So that's some of the things that the doctor will talk to you about. If you tell them you drink, that's one of the things they'll tell you. Hey, if you're you've been drinking, please do not get behind the wheels, because number one, you're risking your life. Number two, you're risking other people's lives. So let's say you get in an accident, but you don't get injured, but you injure another person, or you lead to their loss of life. I don't know how you're gonna live peacefully knowing that you caused someone else to lose their life. And this person might be a brother, sister, somebody else's relative. So those are some of the things the doctor will talk to you about. They'll talk to you about medications. Are you taking any medications? If you are you compliant with them? That's a very important aspect of lifestyle, because if you are required to take medication on routine basis, it's required for you to take it to help keep you healthy, or to help keep you within a manageable level. But if you're supposed to take a medication every single day, but you choose to take it just when you feel like, or you skip several days, as we know, things are not gonna go right your way. So those are some of the things they'll talk to you about: medication compliance, monitoring for medication side effects. Because let's say for chronic care illnesses, a lot of your visits will be maybe every 3 months or every 6 months. Occasionally it will be once a year. So your doctor will not be with you when you're taking these medications, and the most they do is educate you on some of the side effects, things to watch for. If a medication can lead to liver failure, they'll teach you to monitor for some of the side effects of the medication that can lead to liver failure. So I can't stress enough on the importance of preventative care. The provider will also talk to you about your mental health, just to see, are you sleeping okay? Do you feel depressed? How is your anxiety level? Are things under control, or do you feel overwhelmed? If it is something they can manage within their scope of practice, they'll go ahead and do that. But if they need to refer you out to a psychiatrist or to a counselor, they'll do that as well. So I know it's a lot of information, but it is very, very important information. Remember, they say a stitch in time saves. Oh my goodness, I blanked out. A stitch in time saves 9. Is that right? I don't know. Anyway, something like that. It's just about starting early, and that's the main goal of preventative care. So if you haven't seen your healthcare professional within the last 1 year, I challenge you to get your phone, call, find somebody around there who can see you, who can get you in line. And with this, you'll know that you're on the right track health-wise. Thank you so much for joining me in this video, and I hope to see you in my next educational video. Till next time, peace out.